Hello friends, welcome to CNS Viewpoint. Today we are going to talk about an important learning for me, which I learned as being part of the moderation team for the South Asia Tobacco Control course of John Hopkins Bloomberg School of Public Health Institute for Global Tobacco Control. One of the experts said that PM Cares Fund of Government of India or of the Prime Minister Modi had received funding from the tobacco industry. This is just so, unbelievable, because tobacco industry money has historically tried to clean its image, whitewash its image by using such opportunities of humanitarian crises, of emergencies, whether it is public health emergencies or natural disasters, etc., to show that they are good guys, quote unquote. But they are actually the killer guys, and they have tried to leverage that position of quote unquote corporate social responsibility, because they are the most irresponsible corporations in the world, who have a long, well documented history of how they have deceived our children, our young people into addictions. They have lied to the consumers. They are directly responsible for causing the death of 1 out of every 2 of their consumers. So, and there's so much more which I can say against that industry. So imagine, that despite India and several other countries, more than 180 countries out of 193 or 494 have already ratified the Global Tobacco Treaty, formerly called the World Health Organization Framework Convention on Tobacco Control. Article 5.3 of this Global Tobacco Treaty obligates every country. It's a legally binding treaty, legally binding corporate accountability treaty, legally binding public health treaty. And Article 5.3 of this treaty obligates all the governments to stop tobacco industry interference. And one of the things is to not take any CSR money, etc., like this. So tobacco industry, instead of, tobacco industry is trying to clean its image even during the public health emergency of COVID-19. When in reality, government should have held it accountable, made it pay for making our population more vulnerable to COVID-19. See, all the comorbidities associated with COVID-19, which increase the chances of a person, if the person gets infected with coronavirus, of serious outcomes of COVID-19, including death, such as, and those comorbidities, the common risk factor is tobacco use. So whether it is cardiovascular diseases, or it is range of cancers, diabetes, chronic respiratory diseases, tuberculosis, there's so many more. So hypertension, etc. And you will find that the common risk factor is tobacco use. If governments had implemented tobacco control better, as per the evidence years back, decades back, if governments had stopped the tobacco industry interference, because 5.3 was adopted in 2008, 13 years before the pandemic struck us. If we had stopped tobacco industry interference, because tobacco industry interference is one of the biggest obstacles to tobacco control and sustainable development, if we had done that, less people would be using tobacco, less people would be vulnerable to these comorbidities or suffering from these comorbidities, and less people would be hypothetically, facing serious outcomes of COVID-19 and dying. So governments need to hold them accountable, legally and financially liable to these tobacco industry. And Article 19 of the Global Tobacco Treaty, WHO FCTC, empowers our governments to be able to do so. Governments have to take more leadership in operationalizing this Article 19 of the Global Tobacco Treaty in the Global Tobacco Treaty negotiations as soon as possible, without any further delay, as well as nothing is stopping the governments to advance more domestic laws and policies to hold abusive, polluting and disease-causing, death-causing industries to account in their own home turf, as per the domestic laws and policies. So let us hope that happens, and let us hope that tobacco control it becomes it's not tobacco control, it's rather tobacco and tobacco is what is in urgent priority. We have no time if we are to deliver on sustainable development, if we can, and if we want to deliver on a healthier world, a socially just and ecologically sustainable world. And tobacco is an imperative, it is not a choice anymore. And holding tobacco corporations is just one important essential cog in the wheel. So hoping that it happens, hoping we take apart the tobacco industry, but also we ourselves take a part each. As one of the panelists in this course, Patricia Lambert, stalwart in tobacco control, especially in the last 2-3 decades. Said. So let us hope, and with this hope, that I will end today's CNS Viewpoint. And tomorrow again at 5 p.m. I'll be back with our thoughts and views and perspectives on something that made us think. See you tomorrow, 5 p.m. Bye till then.